Welcome back to Journey to 600. Today we're going to be talking about anatomy of the knee. We're going to go through the knee joint, osteokinematics, arthrokinematics, ligaments of the knee, as well as muscles of the knee. So starting off for the joint, the primary knee joint is the tibiofemoral joint, which is composed of the femur and the tibia. Part of the knee joint as well is the patellofemoral joint, so that is where the patella sits in the femoral groove. Next, we're just going to highlight the roll and glide. So with the tibiofemoral joint, like I said, you have the femur, which is convex. You have the tibia, which is going to be concave. So if you know the convexity and concavity of the bones plus the rule, then you can figure out the arthrokinematic of the joint. So the rule is convex on concave. The roll and glide is in the opposite direction. If you have concave bone moving on the convex bone, the roll and glide is in the same direction. So for example, in this picture here on the left, that is going to be closed kinetic chain extension. So you have the femur moving on the tibia, so the convex femur will roll anterior and glide posterior. For the picture on the right, that is open kinetic chain, so that's when the tibia moves on the femur, and so the concave tibia will roll and glide anterior to cause extension. So osteo and arthrokinematics of the knee. Primary motions of the knee are flexion and extension. So open kinetic chain is when you're typically non-weight bearing and the femur is fixed relatively while the tibia moves freely. Closed kinetic chain is when the tibia is relatively fixed and the femur moves on the tibia. So for open kinetic chain flexion, the tibia rolls and slides posterior. In closed kinetic chain flexion, the femur will roll posterior and slide anterior. For extension, open kinetic chain, the tibia will roll and slide anterior. For closed kinetic chain, the femur will roll anterior and slide posterior. Moving on to the ligaments of the knee. So the ACL attaches anteriorly on the tibia and posteriorly on the femur. It is going to prevent anterior translation of the tibia. For the PCL, it attaches posteriorly on the tibia and anteriorly on the femur. So the ACL and PCL, they crisscross. That's why they're called the cruciate ligaments, because they create a cross. So in the picture displayed to the left, the anterior cruciate ligament is that blue one, and the posterior cruciate ligament is the yellow one, and they are crossing the middle of the knee there. Next, the MCL attaches from the medial epicondyle of the femur to the medial condyle of the tibia, and it's going to help stabilize the joint and prevent excessive valgus of the knee or inward movement. The LCL attaches from the lateral epicondyle of the femur to the lateral surface of the fibular head. It also is going to stabilize the joint and prevent excessive varum or outward motion of the knee. Next, the meniscus. So it is not a ligament, but it is a C-shaped fibrocartilage that sits between the femur and the tibia or inside the knee joint. The meniscus gives stability to the knee joint and acts as shock absorption. So you have a lateral and a medial meniscus. Typically, the outer portion of the meniscus is vascularized, so it has better potential for healing. The inner 2/3 is avascular, lacking, meaning that it lacks blood supply, so those will not heal on its own. Now going to muscles of the knee, so the quadriceps, which is composed of the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. So quad meaning four, so four muscles make up the quadriceps. Vastus medialis and lateralis, that tells you kind of where it is on the medial and lateral side. Vastus intermedius is in the middle, and it is deep to the rectus femoris. The quadriceps help extend the knee. Next are the hamstrings. So the hamstrings are a group of three muscles, and it is the biceps femoris, semimembranosus, and semitendinosus. The hamstrings are responsible for flexing the knee. Lastly, we're going to talk about the adductors. there are more than one adductor, but the gracilis is the adductor that crosses the knee joint, so it is going to help flex the knee or internally rotate the knee when flexed. Okay, that is all for the anatomy of the knee. It's a lot more simple than the shoulder. So our first practice question is, a 6-year-old patient reports to PT for an eval and treat for bilateral knee osteoarthritis. Upon examination, you noted decreased knee flexion and pain with weight bearing. You want to test strength of knee extensors. Which of the following muscle groups is responsible for knee extension? A, quadriceps, B, hamstrings, C, adductors, D, peroneals. I'll give you a moment to answer. Please pause if you're not ready to review. This is not necessarily a scenario question, but you have a lot in this question. So you have a 6-year-old patient, bilateral knee osteoarthritis. In the exam, you have decreased knee flexion and pain with weight bearing. But really, when you get to the root of the question, or the stem of the question, it says, which of the following muscle groups is responsible for knee extension? So you didn't really need to know any of that question. You just need to know, okay, what muscle does knee extension? So that would be A, quadriceps. Quadriceps are responsible for knee extension. It is made up of the rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius. Practice question number 2. A 6-year-old patient reports to PT for an eval and treat for bilateral knee osteoarthritis. Upon examination, you note decreased knee flexion and pain with weight bearing. Which of the following would support the intervention to improve knee flexion range of motion? A, anterior glide of the tibia, B, posterior glide of the tibia, C, posterior glide of the femur, or D, superior glide of the patella. I'll give you a moment to answer. Please pause if you're not ready to review. So this is the same question as before, but it is asking something different. So it is asking, what will help improve knee flexion range of motion? So we are looking at what glide occurs during knee flexion. So we'll go through the answers. Anterior glide of the tibia. So anterior glide of the tibia occurs during open kinetic chain extension when you have the roll and glide of the tibia anteriorly. So that will be extension. B, posterior glide of the tibia. So if the tibia is moving, that would also be in open kinetic chain. So the tibia roll and glides posterior, that would be knee flexion. C, posterior glide of the femur. So the femur is moving, that means you're in closed kinetic chain. So in closed kinetic chain, the femur would be rolling anterior and sliding posterior, which would be knee extension. So that is not answering the question. And then superior glide of the patella. We did not talk about glides of the patella today, but superior glides of the patella will actually cause or help knee extension. So that is not what the question is asking either. So B, posterior glide of the tibia is the best answer. So when you have a posterior glide of the tibia, that is during knee flexion, and that will help improve knee flexion range of motion. Thanks so much for watching. Don't forget to like this video, subscribe to our channel, and turn on notifications. See you next time on your journey to 600.